Hi, in this video, I'm going to be talking about neoadjuvant therapy for breast cancer. What is it? When do we give it? What are the benefits? Are there any disadvantages? And how does the treatment change if you have neoadjuvant therapy? Before I go on, I'd love to invite you to subscribe to our channel. We put out 3 videos a week, so there's always new content for you to watch. Neoadjuvant therapy is a really funny term. Neo meaning new, and adjuvant is a jargony term we use to describe treatment in the absence of measurable disease. So that's adjuvant therapy is what we give after surgery when the tumor's been removed. Neoadjuvant therapy is extrally jargony because we're giving new adjuvant therapy. That's neo means new. So I like the term primary systemic therapy. We're giving systemic therapy like chemotherapy, hormonal therapy, or targeted therapy as the primary treatment through your whole system before you have surgery. So when people are offered neoadjuvant therapy or primary systemic therapy or preoperative chemotherapy or therapy, they have a lot of questions, and I'm going to go through each of those. We often think it's so much better to get that tumor out right away before it spreads, and that impulse makes a lot of sense. But the main reason we want to get it out before it spreads is because we don't want those cells that might have spread to grow and multiply and establish a home in other parts of the body, like the liver, lung, or bone. Giving systemic therapy first can actually help that spread from we want to keep that spread from happening. So why not treat the whole system first? So it actually is very reasonable to give your systemic therapy before surgery. We know that doing so does not impair your outcome, and there's some good things about it that I'll cover next. So why would we do systemic therapy before surgery? Well, the main reason we do it is to improve surgical outcomes, and that refers to 2 things. The first is that we can shrink the tumor in the breast, and that can allow for better margins when you have the lump removed. Even if you're having a mastectomy, it can make the tumor easier to remove, especially if it's up against the chest wall or in the front of the breast against the skin. We want that tumor to recede and shrink, so no matter what surgery you're having, the surgical outcome can be better. Some people who are told they need a mastectomy can actually have a lumpectomy or breast-conserving surgery if we shrink the tumor sufficiently to allow for you to keep the breast. The other reason surgically that we like to do it is because if your lymph nodes are involved and they might be sort of stuck together, if they're enlarged enough we can feel them, or we see them on an ultrasound and it's pretty clear that they have cancer in them, we can make the operative field easier to clear of those lymph nodes that have cancer. And I don't mean easier on the surgeon, I actually mean easier on you, because it's a less extensive surgery. We still need to remove those lymph nodes, but instead of the lymph nodes being stuck to one another and sort of matted in the armpit area, they're looser, and it's easier for the surgeon to get all of those nodes out. It makes your recovery time a little quicker in many cases and may have other advantages like decreasing the risk of lymphedema. Though we don't have a lot of data supporting that, theoretically it makes a lot of sense. There are other reasons. If you're planning on reconstruction and it's a while before the plastic surgeon and breast surgeon can coordinate their schedule, you might even be done with all of your treatment, particularly chemotherapy, by the time you get into the operating room. Similarly, if there are other things you want to delay your surgery decision for, and you know you're going to need systemic therapy, like genetic counseling and testing, or if you are early on in your pregnancy, like early in the 2nd trimester, sometimes delaying surgery and getting systemic treatment started may make a lot of sense for you. There are some other reasons that I won't go into here, but your particular case will be explained to you by your medical team why you're having this. It doesn't guarantee that you'll be able to keep the breast. If you still have enough tumor in the breast that a mastectomy is advisable, that's going to be the treatment you will get. Or if you have non-invasive breast cancer in multiple parts of the breast, keeping the breast is not in your best interest. But for many people, giving chemotherapy or hormonal therapy or targeted therapy first can shrink the tumor and lead to better surgical outcomes. What about survival? I mentioned at the beginning of this video that survival isn't worse, is it better? We actually have very little evidence that it's better. So breast cancers tend to be slower growing than nearly most other cancers, and starting treatment a few months earlier or a few weeks earlier doesn't appear to have a major favorable impact on survival. There are some studies that show that people with estrogen receptor negative tumors and younger people benefit in terms of survival, but a lot of those analyses were not planned when the study was designed. So it's really hard for us to say, for any physician to say getting your primary systemic therapy will improve your survival. What we do know is it doesn't make it worse. There are occasionally people where the cancer will grow when they're on primary systemic or neoadjuvant therapy. And in my experience and the literature, those people would have had sort of inexorable growth of the tumor even if they had surgery first. That cancer tends to be more difficult to treat and would most likely have progressed in other parts of the body, regardless of whether surgery was done first. Again, that's quite uncommon, but I want to be really forthright with you. After you have your primary systemic therapy, we do recommend that the tumor be removed. There are lots of studies where people get endocrine therapy alone, especially older patients, and then don't have surgery. And if that patient lives long enough, that tumor is likely to come back and progress in the breast, and surgery would be advised at some point. There are people who are living with other serious conditions where giving endocrine therapy or hormonal therapy first and not doing surgery if the tumor responds can make a lot of sense. People with multiple medical comorbid conditions may benefit from endocrine therapy alone. But unless you are participating in a clinical trial, removal of the tumor is recommended. Our radiation therapy decisions are based on the extent of the tumor before systemic therapy. So even if the tumor shrinks dramatically, we will base our radiation decisions on the tumor before it shrank, so that we don't undertreat somebody who had a larger tumor to begin with or multiple positive nodes to begin with. Your treatment will proceed just as it would if you were getting surgery first. Lymph nodes may have been looked at before you started systemic therapy, or they may be operated on after as well. So that all depends on how much disease was in your body, in the breast and the lymph nodes. And then your recovery will proceed just as it would have. Additional decisions are made in terms of systemic therapy, are based on the hormone receptor status, the HER2 status, how much disease is left if you have chemotherapy first, how well did that chemotherapy work. If there's still a lot of disease, we often will offer you chemotherapy after surgery as well as before. As I mentioned, radiation therapy is based on the extent of the tumor before the systemic therapy. And as with anybody getting a mastectomy, you are likely to be a candidate for breast reconstruction. I've talked about a lot. I hope this has been helpful to you. Drop a comment or question below. Although we can't give medical advice, we can give you more information on how patients like you might be treated, or how information for people like you might look. So drop us a comment or question. Don't forget to go to yerbba.com to get your personalized report and to subscribe to this channel. Thanks for watching.